Now,
Does that?
we do PRP for hair growth. So males and females, because there is good science. How?
What's PRP?
Platelet-rich plasma. So what you're doing is you're taking a tube of your own blood or a couple tubes, putting it in a centrifuge, spinning it down to where you get the serum. And in that serum, above where the red blood cells are all the platelets. The platelets have all the growth factors attached to them. So when your body's damaged, platelets go to the wound, they release all their growth factors, blood vessels start growing in, collagen starts growing in, all the clotting factors are there so you don't bleed to death. If you take your plasma, the platelet-rich plasma, after you spin it down and inject it into people's scalps, you'll stimulate blood flow to help hair start growing again. You'll thicken up the skin by having the fibroblasts grow more collagen. So there are good studies that it works there. There are some case reports out there with PRP with scars. There are much better things scar-wise that are cheaper. Just regular massage alone, oily things like coconut oil usually does the trick. There are topical silicone treatments like Silogen, which are, they're more expensive, but they don't break the bank. But PRP is expensive.
Okay.
I haven't seen a scar that bad that I would consider using PRP for.
Right. And the silicone treatments for scars, I know women are like, oh, I just took silicone out of my body. Now you're telling me to use silicone on my scars. I mean,
the way that it works, it changes the polarity, sets up the ion interface with your skin somehow. It changes the polarity, or and it's not the pH, it's the polarity, electron polarity. That sort of fakes the skin and body out that scar is healed. It stops forming scar tissue. But yeah, it's still silicone that you're putting on your body. There is the potential for absorption.
Right. I know a lot of people have had good luck with just the coconut oil and manuka honey. They talk about quite often.
Usually.
So, all right. Curious to why fat transfer is not ideal for after explant, or I guess in that same.
It's another invasive procedure to do a fat transfer. Another operation that you got to heal from. You got to make sure it's done correctly so you don't have a problem at the site where they take the fat from. I don't understand how people do that at the time of taking an implant and capsule out, because again, you get that big open raw space in there. And if you just inject a bunch of fat in there, it's going to die. I mean, you're not going to get a huge, amount that's going to, persist with time. So you basically just wasted your fat, but it does work. It's another operation, unfortunately.
Right. Okay. If coronavirus is contracted, can it adhere to and or get inside temporary expanders via the valve? That was Anna Marie.
I mean, theoretically, it could. I mean, that virus gets into your body, respiratory wise, fecal oral route. Now that we know, I don't know if there's been any. It's such a contagious thing, bloodborne. Blood transmission. I'm sure it could be, but yeah, if you have coronavirus, it's in your body, and it's a tiny little virus particle. It can go through any membrane. So yeah, it could.
Right. And I was talking to my
who knows, but
I'm sorry, repeat that.
I said what the implications are, who knows?
Right.
Viruses, they're like sharks. I mean, they're programmed to do one thing, to find their little host cell that's got its receptors on its recipient, so it can invade that cell and divide and make more coronavirus. That's all it wants to do. So it's not going to necessarily hook onto an inanimate object and live there, because there's nothing for it to divide with. There's no purpose.
Right. Yeah, I was speaking with my holistic practitioner today, just briefly, and I was wondering, because they were saying somebody who has diabetes is more at risk with this coronavirus, and I was wondering what the correlation was with that, and she said just because diabetes is inflammatory and this virus is very much an inflammatory process, it's just increasing the inflammation in your body. So that leaves our whole community at risk, because the whole breast implant illness is inflammatory response, right?
Definitely. Absolutely. And it's very scary. I mean, they just figured out, like, people always wonder, like, why is it more prevalent in people with hypertension? What they've had some reports with coronavirus, it can invade the heart muscle. So they've had, people getting a viral myocarditis. The same thing happens coronavirus, and, they're dying from that, virus affecting their heart muscle or causing arrhythmias. So we're learning something new every day.
Yeah, I think that's the scariest part of all this is everybody's learning as they go, and I think it's all of those unknowns that's very, scary for everybody. Gut issues are huge. Mine were awful. I had had a fancy stool test done, that was exciting, when I still had my implants in,
Very
um,
detailed.
a GI map, and it showed that I had a whole host of parasites, and I had, H. pylori. I also tested positive for SIBO. Those were just it was crazy. My holistic practitioner called me and she said, "What's going on with your gut? You're growing like a jungle in there or something." And that's when I had already discovered breast implant illness. And if anybody read the book, I pulled over on the side of the road and just cried to her because I realized, oh my God, yeah, this is me. I definitely have this and I need to get these things out. So gut issues are huge. Can you speak to why gut issues happen, Doc?
You broke up a little bit. Again, it's interesting too because you think the two, at least what I've seen, the skin and the lining of your gastrointestinal system is such a huge surface area as far as an organ system, and they're the two parts where the cells are turning over probably the most rapidly in the whole body. So, you get a breakdown in your skin barrier, or you get a breakdown in the intestinal cells because of inflammation and chronic inflammation, where the cells lose their little cilia to move things around, or the inside lining of the stomach and small intestines, instead of having all that, surface area to absorb nutrients, where it more flattens out. That inflammation has long-term impact on the cells. Plus, once they start to get inflamed, their barriers break down. It's much easier to get bacteria to translocate, other chemicals, other toxic substances back and forth. So, yeah, you do see it. Interestingly, with breast implant illness syndrome, at least the patients that I've seen, that's the skin issues like acne or rashes, the GI issues are the slowest to respond. There seems to be a lot of relapsing on the way to recovery, and it's a response, but it is a much slower, gradual one.
Yeah,
I don't
this
tend to
one.
see people that come back and after a week or two and say, "Geez, I went out and had a double cheese pizza and it was the best thing I've ever eaten and it was fine." No, I mean, it seems that the food issues are less intense, but they still persist.
Yeah. Oh,
So
absolutely.
far,
And
4 years
then what's that?
at least so far with 4 years of patients that I've
Right. Right. My last flare, my acne came back and it's still wreaking havoc. I'm annoyed. um, I was gonna say that also our systems are also crap and we have implants. Because typically we're exposed to parasites on a normal basis, right? Like, but our bodies can kind of filter them out and get rid of them, but because our immune systems are lowered, we're not able to fight them off like we normally could.
correct.
Yeah. Okay. Air, do you see a lot of that or not a lot of that?
I do. I mean, again, too, interestingly, the breathing issues, um, some of it is, mechanical just from the size implants that people have in, just the pressure of the implants on their chest wall. Also, with the larger implant, you're going to have a bigger, amount of scar tissue, just surface area around it. If it's a smooth implant, that capsule is usually stretched out. So that capsule is glued and stuck down to your chest wall, to your ribs, your intercostal muscles, your pectoralis muscle, usually some of the serratus muscles. So all of that definitely has an effect on patients' breathing. Um, and that's usually one of the things when I see patients that have, big implants in, where their implants have moved, where they have a malposition where, they're too low on the chest wall or out into their armpits and all, where there's a lot of dissection to get them out. Usually those are the patients within a day or two afterwards are saying it feels like, an elephant's off my chest. That they
Yeah.
were able to take a full deep breath again, feel a full chest rib excursion again, things that they couldn't feel for a while.
Uh,
So some of it may not be necessarily asthma and reactive airway where you're getting bronchoconstriction, but it's more external from the scar tissue and the effects of the implants.
yeah, absolutely. And I think, they talk about like, oh, well, so and so has a knee replacement and they're fine, or they're, other devices, but these particular devices are sitting right near such vital organs. And that's why we see issues with the heart and issues with the lungs and all of that, right?
Correct. I mean, it's you're right near all that lymphatic drainage for sure.
immunity. And I know that, first of all, this whole thing has created panic and worry, and that is automatically going to make you more susceptible to illness, right? So just trying to stay calm. And I think, I was out working up until last week, and it was really, really stressful, being out there and being exposed. I work in healthcare, and I would come home like just a bundle of nerves. And my mom saw me the other day from a distance, because we're not really seeing each other, but from a distance, I saw her and she said, "You just look so much more relaxed." And so I think if we can stay home, definitely stay home. And if you're an essential employee somewhere, if it's possible for you to take a leave, do it. And if you can't, then just really trying to do certain things to boost your immunity, which we'll talk about. And also, if you can wear the proper PPE. I mean, it's such a crime that these healthcare workers, myself included, we were wearing disposable masks, those very thin disposable masks, and we were given one, and you had to reuse it every day. I mean, it's the most unsanitary process ever.
The only thing masks are doing is protecting other people from you.
r-
The only thing that's going to protect you from getting the coronavirus is if you're wearing that N95 mask all the time.
the N95, right, right. Yeah, that's crazy. So, so some of the things that I was thinking of was rest. First of all, if you're able to be home, certainly getting extra rest is a good thing. And water. I think water with electrolytes is always good. And a nice filtered water if you can. My favorite is Fiji. That's my favorite water. But I think staying hydrated is always good. And then I think a big thing is minimizing your screen time, because we're all always just scrolling through our devices, and it's not good for your psyche because it's constantly all the illnesses in your face. And then I think just the whatever that blue screen it omits, to your body and stuff. I just don't think that that's probably healthy for our system. So I think limiting that is good. And then I don't know if a ton of supplements is always good, because a lot of the breast implant illness ladies have the MTHFR, and sometimes we can't filter through all of those supplements. So I think that, like, my go-tos are vitamin C and vitamin D for sure right now. I'm making my whole family take them. And Danielle mentioned that, what is it called? Liposomal vitamin C. Do you know anything about that, Doc?
Somewhat. It's how if it because all the vitamins and all, most of them are acids, just like skincare products. And
Hmm.
you get them through your skin, which is basic. They sort of attach them to something that's fatty, a liposome. So that's how it sort of sneaks by and travels into your gut, or like a topical something through your skin to get where the living tissue is.
Okay, so that's
Still
good.
vitamin C, but it's a different carrier method.
Right. Um, I'm just looking. We're getting other questions. Sorry. Uh, okay, back to surgery if it gets delayed. Oh yeah, yeah. So we did cover this, and if you want to just go ahead, Doc, and repeat what you said
Your
earlier.
your blood work, your medical clearance history and physical should be fine. Even if they're over 30 days old, it usually just takes me updating them, and that's all that we need to do.
Right. Okay, sorry. I keep looking. I know that's annoying. I'm sorry. I keep looking over there. And then your diet. I think for the ladies, this is important for everybody, right? Like we were saying before, just keeping your immune system up. Diet is so important, and eating a clean diet. Is that
The best time to be home and cooking and skip the takeout by far.
absolutely? Yeah, and like you said, a lot of us have food sensitivity, whether it's gluten intolerance or whatever it might be. I mean, I've eliminated dairy from my diet, and I feel better when I do not eat dairy. And I know as soon as I have something, maybe a piece of cheese or whatever it is, I feel it. And I think my body is just still inflamed. I'm going to be 2 years post explant next month. Yay! Um, but my body still is fighting inflammation, I mean, so I think that really taking a look at your diet, taking this time to look at your diet, and I think that the headspace that we all get stuck in when surgery is postponed like this, I'm not going to pretend to understand how difficult that is right now because you're getting postponed for way longer than any of us ever have. But I think your headspace is like, I have to explant, I have to explant, I have to explant.
Right.
You know, explant is only one part of your healing process. It is the biggest part because without the explant, you're not going to be able to heal your body. But you've got to remember that you are in control of your health and your well-being, and it doesn't start and end with explant. That's just the beginning. So you can be doing all of these other things right now, and get yourself into these habits. You know, like Doc said, at the time to start learning how to, cook healthier meals and maybe start eliminating some of these things from your diet. Eliminating alcohol, even though we're stuck at home. And I know that our kids are making us crazy, or our husband's making us crazy. And, maybe we want to have an extra drink. It doesn't do anything good for our systems. So making those changes now is one thing that you do have control over, since unfortunately you don't have control over when your surgery is going to be. So I don't know if you have anything to add to that, Doc.
Yeah, I agree 110%. And again, I try to tell all my patients, it's very easy for me to sit on the other side and say things because I haven't been in the shoes that the patients have been in. But everything, it's what got you to this point. It wasn't overnight that people got sick from the breast implants. Yes, there are people out there that were perfectly fine, woke up from their surgery, and things started going bad right away. But for most people, it's been a process. I mean, it was, a slow, gradual build up to a certain point of either inflammation or whatever that was a kicking point, or toxicity levels or whatever. But it's an insidious process that got you to a point of being so sick to seek out, what's really going on and look for other ways of diagnosing what's going on with you. So same thing with getting better. Getting the implants out, it's a part. It's the first part. You got to get your implants out, the interface, the capsule that's been, connecting with those implants out of your body. But that's just the beginning of the healing process. It is definitely, it takes time. Some
It,
people it's fast, some people it's slow. Everybody it takes time, and everybody heals differently.
yeah, absolutely. Absolutely. We try to stress a lot.
Yeah, and that's where like groups and like things, hats off to Tara. Like, to have people in groups that are, getting together and helping people, people with similar issues and problems get through this. This is so, so important.
Yeah, absolutely. And that I appreciate you doing this with me, because I immediately had oh my God, I don't know what to do for these poor ladies who are waiting and struggling to get through this. So, when you mentioned it to me and you said, if you want to do anything, like, let's talk to them, let's let them answer, let's let them ask questions, make them feel a little bit more comfortable at this difficult time. That was great. I was like, yes, this is perfect. Because I didn't know how else to help, and I just want to help them. So
And it's very frustrating.
sure, could we have pain, especially when I'm lying on my side? I had pain when I lied on my side all the time as well.
Implant malposition, if the implant's shifting and pulling on certain areas, muscle wise or nerve wise, you'll get pain with it.
Okay.
It's not
Yeah.
necessarily tightening. People that have the opposite, where everything's too stretched out, they have the same amount of pain sometimes.
Right, right,
Different pain, but they have pain.
right. Oops. Yes, talk lymphatic. Yeah. All right, Melissa, I'm gonna have Danielle on here. She's gonna come back and we're gonna do this just like we're doing with
Thank you,
everything.
everybody, again. Please give Tara feedback as to whether this was worthwhile or not. If through all this crisis, if you want to do this again, I'd be more than happy to. So I just hope it's helpful to everybody.
Absolutely. Yeah, I think it certainly was. I think everybody got a lot of questions answered, and we certainly appreciate your time. I'm still getting a couple of things here. Let's see. Oh yeah.
Yeah,
Patients with allergies and sinus infections
yes, they get better.
that get better. Yeah. Yeah. And again, I mean, it's hard to say. Everybody, like you said, heals differently. And I think each system has to take its own time to heal. And we can't, just like how not every system broke down at once, not every system can heal at once. So, you had symptoms that started slow and then progressed and then got worse. It's the same with healing, right? And so it's like this up and down kind of thing. So while, yeah, it's going to get better, it may just take time. Um,
Yeah,
and
usually infectious ones like that, like sinus infections, Once you relieve and get rid of the inflammatory item, the implants, get that thing out of your body, and your inflammatory processes and immune system start to settle down, your ability to fight infections is going to become much better too.
Right. Absolutely. All right. So I think I'm just going to go through these comments because they're so sweet.
I know they're good.
And I
It's
think
good.
to see them. Yeah, this is the
Zoom out so my head fits in the screen.
oh, there's mom again.
Expect her to say something nice.
So, all right. And you guys are very welcome. We're really happy to do this. And if you think it will be worthwhile to do it again, Dr. B and I have some extra time on our hands, so we will do it again. And yes, I think Dr. B is hoping to see you all at the surgical center in May and June for sure.
Definitely.
I don't know. Any other thoughts? Let's see. Thankful. Tell Alicia we're willing to do pre-op consult via telemedicine. I just emailed her. Perfect. We love your office staff too. I know that they work really, really hard behind the scenes, and it is not always easy for those girls. And yet I think that we are always met with a smile and just they try to help so much. So, always thank them on our behalf as well.
They are a team. I thank them every day.
Good. I'm so glad. Yeah, I'm sure it looks like a fun place to work. I think you guys are a great team. So, ladies, just so you know, I am going to try to get Danielle on here, and I'd like to talk about just boosting your physical and emotional well-being during this time. And we'll give you some tips on how to do that and let you ask questions. Same format as we did here. So, Dr. B, thank you, and we're very grateful for you.
Thank you again.
All right.